Back with Dr. Wolski, medical doctor, pain management doctor in Dallas and in Denton. Denton, do I pronounce that right, Dr. Wolski?
Correct.
All right. Dr. Wolski, tell us a little bit about neck pain. Tremendous amount of people do have neck pain, and I don't think there's any one of us who at one point or another doesn't wake up and say, my God, I must be changing my pillow here because I'm having neck pains. Anyway, tell us a little bit about, the people who have, not just that occasional little twist in it, but who get neck pain, why, where, and what are some of the remedies applied in your practice?
Some of the injuries we see are work injuries or car wrecks. Patients may have an injury at work where they herniate a disc, where it's pinching a nerve, and they have pain radiating down their arms and into their hands. And we also see patients who have car wrecks and have whiplashes get herniated discs. For this type of problem, we do try medications, anti-inflammatories, some pain medications, and muscle relaxers. Then we put them into a physical therapy program where we can do cervical decompression, we can do electrical stimulation, ultrasounds, we can do exercises to make their muscles stronger. We can do epidural steroid injections in our office where we have a needle go into the space around the nerve to deliver some cortisone. That cuts down the inflammation around the nerve, and that cuts down the pain. And then if they have long-lasting pain and it goes on for 3 months or more, we can offer a chronic pain management program, and that involves it's a 20 to 30 day program. It's fairly intensive. It's 8 hours a day. It has a lot of counseling and a lot of therapy associated with it. Also, we do vocational planning.
Wow. So it looks to me that, like with most things in life, there is no really one solution, and maybe that's sometimes, would you say that that's sometimes a problem that a person goes and says, okay, chiropractor, let's go there, or massage, let's go there, or injection, let's do that, or get, that machine which pulls you apart, the what do you call that machine? Decompression thing. Whatever it might be, or physical therapy. And what I hear from you here is a person simply might potentially need all of it. And it's the synergy which makes it working. Am I far off here, or what's the deal?
You're correct. We've got all those services at one location, and the synergy does work. And there's a lot of medical data and medical studies that show that a multidisciplinary approach does work for these people with chronic pain, with long-lasting pain.
Yeah. Well, it's like with, keeping a marriage alive. It's not about one thing. It is lots of things husband and wife need to do to keep it, nice and beautiful. Economically, there's just never one thing one needs to do to, so to say, stay alive and to do well. It's always lots of things. And as more as you want to boil it down to, of what's that one thing you want? If there's nothing else you could do, which one would you do? That alone, it looks to be opening the door for most of us who, take the way of less resistance, and maybe we're all a little lazy, the way we grow up in a society where that's possible, that we now kind of keep looking for that one thing, when yet that one thing doesn't exist. Like in football, the quarterback may be the most important person. He may not be, but one thing is for sure, he won't win the game alone either. Right?
That's right. We have a team concept, and a lot of we just don't write pain pills to control pain. We do everything we can to minimize the addictive potential of narcotic analgesics.
I think more and more people, from what I notice, are appreciating that, because as you see, there's more whole food markets spreading up. It just seems to be a huge trend of people going back to the natural. In fact, there's a number out there where, as about 10 years ago, 45 million visits have been made to an alternative healthcare practitioner, and currently it's approximately 450 million people have done that a year to an alternative healthcare practitioner, which of course includes anything from massage to physical therapist to chiropractor to the vitamin guy. But that's a huge increase in just 10 years, from 45 million to 450 million. It's a huge increase, and the trend by no means is stopping, which means people start realizing that we got to let the body cue itself and give it what it needs, the right nutrition and the right movements and all that stuff. So you seem to be basically right there, part of that huge trend, it looks like.
Yes, we try to do multidisciplinary pain management, and it involves, like you said, chiropractors, MDs, counselors, psychologists, massage therapists, and kinesiologists.
Right. I myself.
We don't have acupuncture, but we can refer folks that need acupuncture out.
Right. Well, again, thank you very much for letting us know. So there is a treatment involved. So one thing patients do need to look forward to, well, not necessarily look forward to in a beautifully I want to go to Disneyland look forward to, but they need to realize that they gotta get involved a little bit. It may take a tiny bit of time, but after that, years and years of pain simply might be gone. Is that kind of like a good assessment?
Well, they need to get involved, and we teach them pain management techniques like muscle relaxation, progressive muscle relaxation, self-hypnosis, and we teach them home exercises that they continue to do after they leave. Another thing we do is a lot of these people may have maybe very overweight, and that's maybe contributing to their pain. We teach them how to eat correctly and how to lose weight to help their pain.
Well, appreciate your candidness, Dr. Walski. Thanks a lot.
Thank you.